Hey everyone, Dr. Sean Bryan here with E3 Chiropractic and Wellness, and today we're going to be closing off our month of rib joint dysfunction education videos. So today we're going to be discussing some take-home exercises that I like to prescribe my patients when they come in with rib joint dysfunction. After we've done that in-clinic treatment, I like to send an early exercise home, and this is just a quick and easy one that kind of reinforces the motion that we just regained. So after we've delivered that adjustment and we've worked a little bit on it in office, I like to send a quick and easy exercise, and I like to call these reverse pullovers. So if you grab a towel and kind of fold it up so that it's relatively skinny like this, and then placing it behind our back and holding it like on either end with our palms facing each other like that, we're just going to be standing up nice and tall and then reaching back as far as we can. And when we do this, we're just reinforcing that extension through the thoracic spine, the rib joints themselves, and then starting to get a little bit more of that pump handle rotation at the rib joint themselves. So an awesome place to start with these is frequently doing them throughout the day in sets of 10 to 15, and just kind of spacing them out every few hours throughout the day, just kind of to reinforce that motion through those ribs in the upper back. An awesome way to kind of reduce some of that irritation, and again, just keep that motion that we just regained. When we start to talk about the things along the lines of proper breathing patterns, low back stabilization strategies, and then scapular stability, one that I'll typically send home with patients is getting them to come down onto their knees and then sink their butt towards their heels, elbows down on the ground. We try and find a flat spot with a neutral spine in our back, and then we're going to push our shoulder blades and our elbows into the ground, so protracting our scapula into the ground here, and then tucking our chin and thinking, getting really long through the spine here. And now we just start to work on breathing. So our proper diaphragmatic breathing, which would have been done in office, but we start to think about breathing in through our belly and pressing our belly hard into our thighs in that position. So a lot of force kind of going through our shoulder blades here, working on the stability of our scapula, and then we start to work on that respiratory cycle by breathing in through our belly and pressing that against our legs and just relaxing in that position. So that's an awesome starting spot for some home exercises with this rib joint dysfunction. Hopefully this information helps. And if not, and if you guys have questions, feel free to swing by the clinic and we'd be happy to chat about it with you. Thanks. Take care.